Dementia is a debilitating condition that affects millions of people worldwide. In the United States alone, approximately 5.8 million people are living with Alzheimer's disease, which is the most common form of dementia. This number is expected to rise as the population ages. Dementia not only impacts the individuals diagnosed, but also places a significant emotional and financial burden on families and caregivers. Understanding the causes of dementia is crucial for prevention and early intervention. In this video, we'll explore the various risk factors and causes of dementia, helping you better understand how to manage and potentially reduce the risk of this condition. Stay tuned to learn more about what contributes to dementia and how to address these factors for better brain health. One, age. Age is the most significant risk factor for dementia. As we get older, the risk of developing dementia increases. Approximately 1/3 of all people aged 85 and older may have some form of dementia. While aging is a natural part of life, it is essential to engage in activities that promote brain health as we age. Keeping the brain active through cognitive exercises, maintaining social connections, and leading a healthy lifestyle can help reduce the risk of dementia. 2. Family history. A family history of dementia can increase your risk of developing the condition. If you have close relatives, such as parents or siblings, who have been diagnosed with dementia, your risk may be higher. Genetic factors play a role in the development of some types of dementia, such as Alzheimer's disease. While you can't change your genetic makeup, being aware of your family history can prompt you to take preventive measures and seek early medical advice if you notice symptoms. 3. Down syndrome. People with Down syndrome are at an increased risk of developing dementia, particularly Alzheimer's disease, as they age. This is because the genetic changes associated with Down syndrome can also lead to the accumulation of amyloid plaques in the brain, a hallmark of Alzheimer's disease. Regular health checkups and cognitive assessments are crucial for individuals with Down syndrome to monitor for early signs of dementia and implement timely interventions. 4. Head injury. A severe head injury can increase the risk of developing dementia later in life. Traumatic brain injuries, TBIs, can damage brain cells and lead to long-term cognitive issues. The risk is particularly high for individuals who have experienced repeated head injuries, such as athletes in contact sports. Wearing protective gear, practicing safety measures, and avoiding situations that could lead to head trauma are important steps in reducing this risk. 5. Heart disease. Heart disease is a significant risk factor for vascular dementia, which occurs due to reduced blood flow to the brain. Conditions that affect the heart and blood vessels, such as coronary artery disease and congestive heart failure, can compromise the brain's blood supply. Maintaining cardiovascular health through a balanced diet, regular exercise, and managing conditions like hypertension and diabetes can help reduce the risk of vascular dementia. 6. High blood pressure. High blood pressure or hypertension can damage blood vessels in the brain, increasing the risk of vascular dementia. Hypertension can lead to the narrowing and blockage of arteries, reducing blood flow to the brain and causing cognitive decline. Monitoring and managing blood pressure through lifestyle changes and medication, if necessary, is crucial for brain health and reducing the risk of dementia. 7. Diabetes. Diabetes, particularly type 2 diabetes, is associated with an increased risk of dementia. High blood sugar levels can damage blood vessels and nerves, including those in the brain. Insulin resistance, a hallmark of type 2 diabetes, can also affect brain function. Managing diabetes through a healthy diet, regular physical activity, and medication adherence can help reduce the risk of cognitive decline and dementia. 8. High cholesterol. High cholesterol levels can contribute to the development of dementia by promoting the buildup of plaques in blood vessels, including those in the brain. These plaques can restrict blood flow and lead to vascular dementia. Regular cholesterol screenings, a heart-healthy diet, and medications prescribed by a healthcare provider can help manage cholesterol levels and reduce the risk of dementia. 9. Obesity. Obesity is another risk factor for dementia. Excess body weight can lead to various health problems, including hypertension, diabetes, and high cholesterol, all of which are risk factors for dementia. Maintaining a healthy weight through a balanced diet and regular exercise can improve overall health and reduce the risk of cognitive decline. 10. Smoking. Smoking has been linked to an increased risk of dementia. The harmful chemicals in tobacco can damage blood vessels, reduce blood flow to the brain, and increase the risk of vascular dementia. Quitting smoking is one of the most effective ways to improve cardiovascular health and reduce the risk of dementia. Resources such as smoking cessation programs, counseling, and medications can support individuals in quitting smoking. 11. Depression. Depression is associated with an increased risk of developing dementia. Chronic depression can lead to changes in brain structure and function, increasing vulnerability to cognitive decline. Addressing mental health issues through therapy, medication, and lifestyle changes is essential for maintaining brain health and reducing the risk of dementia. 12. Social isolation. Social isolation and loneliness have been linked to an increased risk of dementia. Engaging in social activities, maintaining strong relationships, and participating in community events can promote mental and emotional well-being, reducing the risk of cognitive decline. Building a supportive social network and staying connected with friends and family are crucial for brain health. Understanding the various causes and risk factors of dementia is essential for prevention and early intervention. Age, family history, Down syndrome, head injury, heart disease, high blood pressure, diabetes, high cholesterol, obesity, smoking, depression, and social isolation all contribute to the risk of developing dementia. By addressing these risk factors through lifestyle changes, medical management, and social engagement, you can reduce your risk and promote brain health. If you found this video helpful, please give it a thumbs up, subscribe to our channel for more health tips, and share it with your friends and family. Don't forget to hit the notification bell so you never miss an update from us. Thank you for watching, and take proactive steps to maintain a healthy brain and reduce the risk of dementia.